Hello, viewers. Thanks for joining us for our prenatal and postnatal Facebook Live series. My name is Nadia, and I'm a health promoter with the Family Health team here at Niagara Region Public Health, and I will be the host of today's event. Today, we will be talking about what to expect when you're expecting and answering the most frequently asked questions about pregnancy and leading up to labor. So today, I'm just going to share our hosts that we have today. So today I have with me Alannah, who is one of our public health nurses in reproductive and child health. And we have Jen, who is a registered midwife joining us from Niagara Midwives. Alannah, thank you so much for being here today. If you wouldn't mind sharing a bit more about yourself, your professional background, and your current role.
Yeah, no problem. So thanks for having me. My name's Alannah, and I'm a registered nurse. I'm in the role of a public health nurse at Niagara Region Public Health, specifically in the child and reproductive health program. So I've been a nurse for over 4 years now. I started my career at McMaster Children's Hospital, and I have since come to public health. In my role here at Niagara Region, I offer some prenatal supports along with some of my colleagues. We offer prenatal one-on-one appointments as well as some group prenatal sessions, along with some other work on the side as well.
Perfect. Thank you so much, Alannah. And now we have Jen, one of our midwives here. Jen, would you tell us a bit more about your professional background, your role, and maybe explain a little bit more about Niagara Midwives?
Sure. Thank you for having me. My name is Jen, as mentioned, and I am a registered midwife. I work at the Niagara Midwives, which is one of 3 clinics in the Niagara region. Ours is located in St. Catharines. All 3 of our clinics, we all have privileges at Niagara Health, where I am also the head midwife, in the role of the head midwife at Niagara Health. I have been a midwife for, my goodness, 12 years, and we just love providing prenatal and postpartum care to our patients here in the Niagara region. I think we'll get into a little bit more with some of the questions with regards to midwives and how we provide services, so I won't take up that time now.
Awesome. Thank you so much. So before we really jump into all the amazing questions we have, I just want to do some logistic reminders for everybody. So if you have any questions throughout the presentation, we welcome you to put them in the chat section where we will pass them on to our presenters. If we are unable to answer any of your questions, we will ask that you reach out to us via Niagara Parents or Niagara Midwives, depending on your question that you have. Niagara Parents is available to answer your questions by phone, live chat, or sending us a Facebook message. This Q&A will be recorded and will be available for later viewing on our Facebook and YouTube channel. We will also share links to resources that may be mentioned throughout the Q&A this afternoon in the comments section. So without further ado, let's begin with some questions that were submitted ahead of time. So let me grab those. So I guess I'll point this to Alannah, this question: how will I feel when I'm pregnant?
Okay, that one's a loaded question. Everyone will experience pregnancy differently, so can kind of give a general overview of like physical changes and feelings. But we'll start with some kind of physical feelings when you're pregnant. So during the first trimester, your body will go through some like dramatic changes. And by the end of the first 13 weeks, you might not look very pregnant, but you will probably feel quite different. This is the stage where the hormones will cause most changes in the body. The placenta that supports your baby is growing and developing during the first trimester, and that actually takes a lot of energy from your body. So that's one of the reasons you might feel so tired in those early months of pregnancy. The changes in your body may not be noticed by other people. And honestly, you might not even notice the size of your uterus changing yourself. Another thing is your milk glands will begin to develop in your breast, so they will feel fuller, heavier, and tender. Your heart will be working harder. You'll notice that you might be more aware of your breathing as well, just with all the changes happening. And your menstrual cycle will also stop in the first trimester. So during the second trimester, you might feel a little more calm and more settled. You'll also notice that your body's size and shape will begin to change, and it may be more noticeable now. Some other physical changes, the color of your skin might be changing due to some of the hormones. So your breasts are beginning to get ready to feed your baby. You may also notice a little bit of colostrum leaking. And then another change that you won't really notice is the ligaments and cartilage in your back and pelvis will begin to soften. But again, that's not something you may notice. During the third trimester, your pregnancy will become more visible. You may begin to become a little bit more uncomfortable with more pressure on your ribs and your pelvis. Your abdominal muscles will start to feel stretched at this point. And you might begin to feel some sharp pains in your groin or vagina as your baby's head moves down into your pelvis. These are all normal changes. You might notice that you're having more of these pains. You'll have some relief in other areas. So it might begin to become easier to breathe, and you might experience a little bit less indigestion as well. And some women will also experience sudden leg and foot cramps during the first 3 months of pregnancy, during the last 3 months of pregnancy. And these mostly happen at night. But everyone, like I said, will experience the pregnancy differently in a physical sense. So it's important to talk about your mental health as well when you're pregnant. So it's definitely normal to have some mood swings during pregnancy. 1 minute you might be feeling happy about being pregnant. The next you might find yourself worried and stressed about the health of your baby or what will happen once your baby's born. The hormones that support your pregnancy and your baby will also have a play in that and affecting your mood. So some women may feel moody all the way throughout their pregnancy, but the highs and the lows are most common between the 6th and the 10th week, and then again in the third trimester. But just talking about this, it's always a good idea to take care of your emotional health when you're pregnant. I mean, anytime, but especially when you're pregnant. You can stay active and eat well, taking some time to rest and relax, trying to avoid stressful situations as much as possible. And remember to share your thoughts and feelings with someone you trust. Don't keep it all inside and bottled up with yourself. Jen, I don't know if you have anything else to add to that loaded question.
I think you did a great job with that. That was a very loaded question. Yeah, and just trying to keep in mind that there's so much variability from one person to another, and to not feel as though something's wrong if you're not experiencing something that maybe a friend or a family member has felt. And when in doubt, always check with your healthcare provider.
Awesome. So our next question kind of goes along with what you were both saying, the feelings. Question we have here is, when does my baby start moving? When should I be worried?
Go ahead, Jen, if you want to take that one.
Sure. And again, I'm just giving information here. And like I said, everybody's going to be a little bit different. There are going to be different variables that are going to play into when you start to feel your baby moving. But basically, in a nutshell, you may start to feel your baby move as early as 18, 19 weeks. You may not start to feel your baby move until closer to the 23, 24 week mark. And like I said, that could depend on what number baby this is for you. It could depend on where your placenta is located. And so really from a clinical perspective, we really don't start talking to people about the importance of counting movements until the baby is 28 weeks gestation. At that point, that's when we really like to pay attention to movement. It is the best clinical indicator that everything is going well with your baby. And so that is when we do start to talk about the formal counting of baby's movements. But like I said, you may start to feel those little flutters in your belly. You might wonder if it's gas. Could be. Maybe it's your baby's little fingers or feet. Partners generally can start to feel the baby from the outside kind of after that 24-week mark. And like I said, there is some variability there depending on what pregnancy number this is for you and where your placenta is.
Awesome. So we have a question from Claudia. Is it normal to get bleeding in the first trimester?
That's a great question, Claudia. And once again, I will give a little bit of information. None of this is clinical information. So if you are experiencing spotting in the first trimester, I would most definitely recommend speaking with your healthcare provider. But that being said, yes, it can be normal. There are different reasons for first trimester spotting or bleeding. One of the reasons could be what we would call an implantation bleed. So once the egg has been fertilized by the sperm and has made its way into the uterus, it's going to implant itself into the uterine lining. And with that comes some potential bleeding. That bleeding can sometimes people notice it and they think, oh, that's a light period, when in fact it might have been an implantation bleed. Some people know they're pregnant and then have this bleed, which can become a bit worrisome and cause some anxiety. But definitely knowing that there can be normal reasons for some bleeding in the first trimester, and that having a little bit of bleeding or spotting doesn't necessarily mean miscarriage. But definitely, if you are experiencing any, please speak with your healthcare provider about it.
Awesome, thank you. We have a question from Callie. Sorry if I mispronounced your name. I'm in third trimester and finding I'm having a lot of round ligament pain. Is there any advice on how to deal with this pain? Is resting best or stretches?
Would you like me to answer that one, Alannah?
Well, go ahead.
Sorry, and can we just confirm that question? Sorry, I was just distracted. That's the life of a call midwife.
There's no babies happening right now.
No babies happening right now. Sorry.
I'm in the third trimester and finding I'm having a lot of round ligament pain. Is there any advice on how to deal with this pain? Is resting best or stretches?
Good question. Totally a common symptom or feeling in your third trimester. And sort of as it was mentioned by Alannah when she was talking about how you would feel when you're pregnant, there is
Jen, I think we lost you. Oh, you muted. Nope. Oh, I think we hear you.
I'm back. I just saw you.
There we go.
you guys, your lips were moving, but nobody was talking to me. Okay, sorry. So as mentioned, you have relaxin in your body, which is a hormone. It relaxes your ligaments and muscles, allowing for more stretching. Did you lose me again?
No, you're just frozen. We can hear your voice.
Okay. Okay, perfect. Maybe I'll turn the video off and see if that makes a difference.
Okay.
Okay. So yes, you have this relaxant. It's causing stretching in your body, which again, it's to allow for the movement of your bones in your pelvis and your growing uterus. The round ligament pain is a very common issue for a lot of women, and being mindful of the fact that you already have very lax ligaments, you don't want to do too much stretching because in fact that could cause more damage and harm. Rest would definitely be a good answer to the round ligament pain. Some people find using bands that you can purchase, like belly bands, to give a little extra support can alleviate some of that round ligament pain. There are always options too of massage or chiropractic to help alleviate some of that if there's some pulling or some unalignment of the pelvis. And again, I don't want to give too much clinical information because I know that's not what this is supposed to be, but that can help. Also, warm baths and Tylenol are always the way to go when you have those pregnancy discomforts. But again, speak with your healthcare provider about the proper amount.
Perfect. Thank you for that. So we have a question from Sarah. We've had kind of a few of these very similar questions, and it's going to be directed at Jen around midwifery. So the question from Sarah is, what is the role of your labor and delivery nurse, and how much support can they provide while you're in labor? I've been waitlisted for midwifery care, and I'm wondering what support I can expect to have from my nurse in labor and delivery.
Great question. Okay, so from a nursing perspective at the hospital, if you do not have a midwife and you present in labor and you're admitted to a room, you will be provided a one-on-one registered nurse that will attend you through your labor and delivery, and keeping in mind, of course, that there are shift changes. They work from 7 a.m. to 7 p.m. So you may notice that if you're having a longer labor or you're being induced, you may experience more than one nurse supporting you through your process, but you do have one-on-one care from a registered nurse. And if you're looking for extra support that maybe is not necessarily just from the nurse who is providing clinical care and also trying to provide you that support, which is very similar to midwives, we really do try to provide as much labor support as we can, but we are also providing that clinical care. So there can definitely be a struggle in balancing that. If you feel that you're somebody who would need more support, one-on-one support, you may want to consider looking into a doula. Doulas are very different from midwives. Doulas are labor support. They don't provide that clinical care. So there's no medical aspect to the doula. However, they provide wonderful one-on-one supportive care through your labor and can help to advocate for you. So if you thought that you maybe needed something a little bit more than the balance that you would get from somebody providing clinical and support, you could go that route as well. But you will receive good one-on-one care from a nurse when you are in labor at the Niagara Health.
Awesome. And another question for you, Jen, is when is the best, and it kind of follows up with kind of something Sarah mentioned, when is the best time in my pregnancy to get a midwife, and what is what does that process look like? Do I need a referral for those services?
That's another really great question. I'm glad it's come up. For those that are interested in midwifery care, we thank you for that, and we would love to provide you, prenatal, labor, birth, and postpartum care. Unfortunately, we are very regulated in terms of how many clients we can take on. And because of that, we do run into this process or problem where we really do ask that if you're interested in a midwife, you do not need a referral from your family doctor. So you can bypass that, and you can go straight to any of the websites of the clinics in Niagara. And as I mentioned, Niagara Midwives is in St. Catharines. Lincoln Community Midwives is servicing the Lincoln catchment area. And then Sage Femme Renaissance Midwives, they have a practice in Welland and a sister practice in Niagara Falls. And they service sort of the Welland, Port Colborne, some of Wainfleet, Niagara Falls, Fort Erie, that catchment area. So you want to go to the website of whichever clinic is in your catchment area and fill out the intake form as soon, and I say this like all joking aside, as soon as you pee on the stick. As soon as you know you're pregnant, please go to the website and fill out that intake form. And making sure that you're doing it in the right catchment area so you are accepted into the right clinic. If you go to the wrong catchment area, we're going to refer you to the right catchment area, and then you're kind of wasting some time. Once you have filled out that intake form, generally you'll hear from the clinic within 2 to 3-ish weeks, whether or not you have been secured a spot or an initial interview with the clinic. At that initial interview, we will go through questions, determine whether or not you really are appropriate for midwifery care, or make sure that you feel that your midwifery care is a good fit for you. And then at that point, we move forward providing care. So the earlier you can submit, I can't emphasize this enough, the earlier you can submit your intake form, the better chances to get in with our clinic, because we are limited to how many people we can take. And we really try to expand midwifery in Niagara. We really have over the years so that we can offer to more people, but we are regulated that way. And if you do end up on a wait list, and I was just actually speaking to our clinic owner in Niagara today, and she said that, say, if we take 380 clients a year, we generally have a wait list of 350. So for everyone we take, we usually have one on the wait list. And the only way to get in off of our wait list would be if somebody unfortunately miscarried, care was transferred for some reason and a spot opened up, somebody moved away, or we've hired a new midwife.
Okay, thank you so much for that answer. So now we have a few other questions. These will be, so Alannah, I'll throw these ones at you. Let's see here. So what are warning signs that should trigger me to call the doctor or go into the hospital?
Great question. That's a really common one that kind of comes up. So again, everyone, as we've mentioned multiple times, they'll experience pregnancy differently. But there is, a list of things that should be a warning sign to contact your healthcare provider or to go to the hospital. I want to start with saying, to trust your instincts, your body best. But I can give kind of a list of some things that may be a warning sign. So like Jen had mentioned earlier, one of the questions that came in, if you have vaginal bleeding or fluid leaking, again, it's always a good idea to seek out some assessment from your healthcare provider. If you do have some bleeding, it can be totally normal, but it can also indicate some other things. So it's never a bad idea to get some assessment with that. High fever, so typically above 37.7 degrees Celsius, or if you're experiencing chills or a rash after fever. Fever can be one of the first indications of an infection, so that's a warning sign there. Vomiting or diarrhea lasting 24 hours or more. Morning sickness is one of the symptoms of pregnancy. So it can be a common symptom, but if it's lasting for more than 24 hours, it can come to have some effect on your nutrition. So that is an indication to get some assessment as well. Recurring or long lasting, unusual or severe headache. So that kind of comes along with, like, if you're seeing spots in front of your eyes, that would be one of those more like unusual or severe headaches. If you notice any like sudden or severe swelling in your face, in your hands, legs, and ankles, again, if it's sudden or severe, that would be an indication. Gaining weight quickly out of the norm for your body and your baby developing. If you're having problems with your vision, any pain in your chest, tummy, or stomach area, again, out of the norm. If you're noticing spots on your face and body that are not normally there or showing up as an unexplained rash. If it hurts or burns when you pass urine, or if your urine becomes red or dark in color. If your baby stops moving or moves less often, and Jen could probably speak to the normal amount of movements per trimester. Jen, I don't know if you have anything to add for that one.
Yeah, I think, Alannah, that is like one of the major ones. And again, so just to be clear, when you have a midwife and you're experiencing any of the things that Alannah had just mentioned, you're going to page your midwife. If you don't have a midwife, you're going to call call Niagara Health, speak to the triage nurse in women in
Jen, we lost you again.
Okay, I'll continue with the list, and if she pops back in, she can touch back upon.
Can you hear me? Sorry.
Yeah.
Yeah, perfect.
I apologize. I'm going to try and move here. I'm in I have terrible reception in Font Hill. It's awful here. Sorry about that. Imagine when I'm answering a page and that happens. It's terrible. Sorry. Did you hear anything I just said?
So you said if you were having any kind of discomfort, call your midwife. If you don't have a midwife, you're going to call the Niagara Health System and talk to the triage nurse and then you kind of like blanked out there.
Perfect. You'll get a little bit of direction as to what to do depending on your gestation and where to go. So that's great. But the fetal movement is, I can't stress this enough, it is our number one indicator that your baby is doing well. So as I had mentioned previously, after 28 weeks, we do talk about fetal movement counting. It's a formal way to count your baby's movements to give you good reassurance that baby is okay. So if you've had a busy day or you've been chasing around a toddler, you haven't really noticed the movement that you would normally be feeling, we want you to lay down somewhere quiet, and you should be counting 6 movements in at least 2 hours. If you get 6 movements in 15 minutes, great, you're done. Wonderful. But it can take up to 2 hours to get those 6 movements. That's the formal counting we're looking at. So if you're worried before paging your midwife or before calling the hospital or presenting to ER, and remember, this needs to be after 28 weeks, we want you to do this formal counting.
Perfect. Thanks, Jen. And then just some other things. So if you're feeling dizzy, faint, or like you might lose consciousness, that is definitely another warning sign. A big one is if you're feeling sad, worried, more angry than usual, maybe if you're crying a lot. The hormones with pregnancy and postpartum can cause some postpartum mood disorders or some postpartum depression. So like I had mentioned in one of the earlier questions, if you're feeling more sad than usual, you're feeling unlike yourself, it never hurts to talk to somebody about it and making sure you're not keeping those feelings in. And then just like another big one is obviously if you're in a motor vehicle accident of any kind, a fall or any injury to your stomach area. And just like I said, anything else that does not seem right, you need to trust your instincts. You know your body best. And, if you have that midwife, give your midwife a page. If you don't have a midwife, then like Jen said, you can call your healthcare provider or call triage at Niagara Health System. Whatever is within reach for yourself. It's never a bad idea to just get another set of eyes or get assessed.
I like what Alannah just said too about trusting your gut instinct. It's something that even after all my years of experience as a midwife, I always do, because nobody knows your body better than you. So if something feels off or you're just not feeling well, always, always reach out to your healthcare provider.
Awesome. So our next question, we'll throw to Alannah, but again, you guys can tag team this one. Are there any in-person prenatal classes you recommend? This is coming from Claudia.
Great question, Claudia. Currently through Niagara Region Public Health, we are not offering in-person prenatal services. We are offering one-on-one prenatal appointments virtually, as well as prenatal group sessions. So we do have a partnership with one of our community programs, Healthy from the Start, Strive Niagara, and myself and some colleagues deliver virtual prenatal group sessions. So that would be something that is listed on our website as well. But currently through Niagara Region, we are not offering in-person prenatal group sessions. With changes and everything, there may be something in the future that comes up, but just in the nature of how our programs are running right now, it is virtual. Jen, I'm not sure if you know of any in-person prenatal services like in Niagara.
I'm not sure. Can you hear me? Because I know the screen just froze, so I'm not sure if you can hear me.
Yep,
Yeah.
we can hear you.
Yeah, okay, great. Okay, perfect. Sorry about that. This is really inconvenient.
No worries.
Oh, yeah. I know that at our clinic, we have a resource binder where we do place cards and pamphlets from people that are offering prenatal, like more private prenatal classes. Again, with COVID, things have changed. Some people are not offering in person anymore. I would say the best advice I could give you when looking for prenatal classes outside of public health, of course, which we all.
Oh, we lost you, Jen. Oh, we'll wait a few seconds, see if she gets back on.
I'll just, with our prenatal one-on-one appointments, just because I did touch upon that as well. Again, they are virtual. I'll kind of just give a little bit what we offer with those. So we do them over Zoom. We can also do them over the phone if there's no access to the internet, so that's fine as well. And we try to keep them as casual as possible. So we will gear them more towards what you are looking to get out of the appointment. So we do have some general topics that we can discuss. So safe sleep, car seat safety, infant feeding, nutrition for yourself, as well as, what to expect in like labor and delivery, pain management, things like that. And then of course we try to answer like any other questions that you have. A big thing with pregnancy is sometimes it's one of those things where you don't even know what you don't know. So we do try to just base our appointments off of what you're looking to get out of it. And we also go through the Healthy Babies, Healthy Children screen as well to see if you would benefit from some other programs that we offer as well. So that's kind of what you can expect from our prenatal one-on-ones. And again, we try to just base it off of client needs and what you're looking to get out of it. So.
Wonderful. Jen, are you there?
I'm back. I moved.
There you go.
Let's see how this works now.
All right. So you were saying that sometimes you have a binder of cards that private people would offer.
Oh, yes. Yeah. So, I mean, we do generally recommend public health to go to first for prenatal classes. And because they are publicly funded, which is wonderful. And I think the majority of the population can access them quite easily. That being said, if you're looking for something a little bit more geared towards, I don't know if you have specific things you're looking for, like hypnobirthing or prenatal yoga, where there is a component of some prenatal education in there. That's more of a private pay out of pocket service, and we carry pamphlets and that sort of thing at the office so that you can access that. But I do think for the most part you can find a lot of that information on the internet.
Awesome. So a question we have from Kaylee. I'm gonna try that name again. So is there anything I should do to prepare my body and my mind for birth? I am taking birthing classes starting tonight to teach me coping mechanisms for the pain, but wondering what you think is what is the best coping mechanism to deal with the discomfort? Is there anything my partner should be doing to prepare better support in the birthing process? It's a good question, a lot in there. So let me know if you need me to repeat anything.
Alannah, do you want to start with that and then I can pipe in after?
Yeah, sure. So it's great that you're taking a birthing class and getting yourself prepared that way. Everyone will experience the labor process differently, so it'll kind of be based upon how your body's feeling and how you can tolerate the discomforts and the pain. Breathing techniques are wonderful. So if you're looking ahead of time, you can find some videos on that and practice those breathing techniques. There's the different positions that you can try throughout labor as well, which you can learn ahead of time and give some practice. And sometimes your support person can also help with those different positions as well. Sometimes during birth, changing positions will help as well. There's different things. I'm not sure what the hospital offers in specifics for the different types of like pain relief, as in, sorry, I shouldn't say pain relief, I should say comfort measures and things. So like a birthing ball or things like that. Jen, you could probably speak more to what the hospital has.
Sure, I can definitely pipe in here just about that. So each labor room at the hospital has a shower with a seat, which can be really helpful using hydrotherapy in labor. We unfortunately only have one room at the hospital that has a tub. I know a lot of people, especially midwifery clients, really do get a lot of relief from using hydrotherapy, whether it is in the shower, standing, sitting, or soaking in a tub. And so that is definitely something to consider for some help with pain management. The hospital also has balls, so you don't have to bring in your own balls. We have balls there. We have the peanut ball, the regular ball. These are all tools that can help us sort of put you into different positions or help you find different positions that are allowing you to cope a little bit better with labor.
Awesome. And I think the follow-up question to that, is there anything my partner should be doing to prepare and to better support me in the birthing process? So having that support person, how to prepare them for this whole adventure.
So as I had kind of mentioned when we were talking about prenatal classes, there are private options such as prenatal yoga, which would not necessarily be for the partner, but that can help with learning some breathing techniques, some squatting techniques, some movement, position changes, that sort of thing. But there are hypnobirthing courses and some prenatal courses that you could attend with your partner that may help give some tips and tricks to the partner on what to do to help support the person that's birthing. There are also some great books. I mean, if you, again, I can only speak for midwifery right now, but I know most of our clinics, we have a library of books. There's a great book called The Birth Partner that I definitely recommend to all birthing partners, whether it's the biological parent of the child or just anybody who's coming in to provide support in labor. There's some nice quick tabs in that book. It's been one of my favorites for years. So you could be doing a little bit of that reading as well.
Awesome. All right, a few other questions. I'm not from Niagara. Oh yeah, I'm not from Niagara. Can I go to any hospital to give birth?
So I was trying to understand, I'm trying to understand that question. So if you are visiting Niagara and you go into labor, is there any clarification to that question, or is it pretty vague?
Let's just go with like if they're a visitor, like say they're from Toronto, water breaks, and all of a sudden it's go time.
Yeah. Okay, yeah. So essentially, if you are visiting, you're not from Niagara, and you need to seek out some medical services, then absolutely you can present to Niagara Health. You'll be assessed in triage and then determined whether or not you need to stay, or you can, be discharged and head back to your home hospital. But yes, absolutely. If you are in Niagara and you are requiring an assessment of some sort, you can access Niagara Health. It's the same as what we sort of tell our patients if they're visiting other or other areas. If they do need an assessment, they can page us, and then if we can't assess and we think that they do need to present to a hospital, they're going to go to the closest hospital.
Awesome. Perfect. Okay, so we have I think this is a huge frequently asked question. So when arriving at the hospital in labor, does the caregiver just leave the car in the fire lane until you're registered? Like, what do I just drop the pregnant person? What do you do? When you get to the hospital, where do I park? What does that situation look like?
So depending on the urgency or what's happening with the labor, the primary spot generally to park when you are bringing in somebody who is in labor, they're right at the very front of the hospital, in front of the main doors of the Walker Cancer Center there, not the emergency doors. There are, and I think there actually might be some of these spots in front of Emerge as well. There are 15-minute drop-off parking spots. Those are the best places to park when you are coming to the hospital. You can park there, and then they're right close to the door. Generally, there are volunteers that are working at the hospital at the door, and they can sort of anticipate when people are coming and they look like they're in labor. They'll probably offer you a wheelchair. And then at that point, you're going to right straight in, as soon as you come in the doors, to the right, there's registration. And there's a spot where you push to take a number. And when you are in active labor, you do not have to take a number. You push the active labor button and they will see you next. You will be a priority at that point. So you don't have to sit there in active labor. And then once you register at registration, again, those volunteers, if you're really unsure of where you're going and you're not familiar with the hospital, they will help guide you. But essentially, there's one big long hallway when you come in. You register to the right, and then you go down that long hallway and up the elevators to the 4th floor, and you will find women and babies right there. Once your person that you're bringing in has been admitted, settled, then you can go down and move the vehicle. But you're generally pretty safe in that 15-minute drop-off zone, like the parking, even if it's a little bit more than 15 minutes, but you didn't hear that from me. After that, you're going to want to move your car to probably a parking lot A or B.
Awesome. And I'm assuming like the other hospitals within the Niagara Health System are very similar kind of setup-ish.
Yeah, to be honest, I'm not 100% certain in terms of like Welland and Niagara Falls, because they don't have women and babies floors. And let's just be clear about that, right? If you're having a baby and you're not calling an ambulance because things are happening too quickly, you're going to the St. Catharines site. Again, I really can't answer what the parking situation is like in Welland or at Niagara Falls, because I'm never there.
Okay.
I think if you're presenting to those hospitals because you're precipitating, moving quickly, you're generally going in an ambulance.
Okay. That's good information to know. All right, so we've had so many amazing questions come up, but we're actually going to wrap things up right now. So if we didn't get to your question, please feel free to reach out to Niagara Parents and or to Niagara Midwives. All of the contact information for those two services are in the chat below. So thank you so much for joining us today. And remember, if you missed something or you want to rewatch, this will be uploaded to our Facebook and our YouTube channels. Thank you so much to Alannah and Jennifer for joining us today and everybody who came out. Another reminder is that we have some more exciting prenatal and postnatal Facebook Live events happening. Our next one being Thursday, April 28th at 7 p.m., where we will be talking about keys to a healthy pregnancy. So you can tune into that one. So everybody, thank you for joining us today and have a wonderful afternoon. Bye.